about this. So just a bit about Dr. Sarebanha. She is a naturopathic physician for adults and children, and her areas of focus include pediatrics, women's health, autoimmune conditions, thyroid issues, digestive health, anxiety, mental health, weight management, skin health, and more. Dr. Shadi Sarebanha is a distinguished naturopathic physician who embarked on her holistic health journey with a solid foundation in Western medicine, first by earning a medical degree in Iran. She then pursued a PhD in Chinese medicine in China, immersing herself in ancient modalities like acupuncture and herbal medicine. Building on this, she expanded her horizons by achieving a doctorate degree in naturopathic medicine at CCNM in Canada. With profound knowledge in Western and alternative medicine, she bridges two worlds together and really gives a comprehensive approach to healing. She also happens to be fluent in English, Mandarin, and Persian languages, and considers that a privilege and strength to communicate with her patients in their native language. Dr. Sarebanha wishes to guide and empower her patients to discover the best version of themselves, and I'm sure that you'll see that. I'm going to let her take that away now. Dr. Sarebanha, to you.
Okay, hello, and thank you, Angela. Hello, everyone. Welcome to today's talk about cardiovascular health. And the main reason we chose this topic was because February was the month of cardiovascular health. So we can go ahead and start because it's kind of like a long topic. And then at the end, you will be given time. If you have any question, I will be happy to answer. So as Angela mentioned, this is more kind of like information. For the best individualized plan, it's better to talk to a healthcare provider to come up with the best plan for yourself. And my mission always was guiding and empowering patients to discover the best version of themselves. And as a physician who has a background in all three medicines, I try to see what is the best for them and what would be the best option for treatment. So in a holistic approach in natural medicine is kind of like looking at the patient overally. So looking at the body, mind, soul, and heart, and then put them all together. So that's why usually the history taking for patients are kind of like taking longer compared to conventional medicine. We have to find the root cause of the issue. As we see today, we will go over some of the risk factors and also causes for atherosclerosis, which is hardening of the blood vessels. And you will see, for example, how insomnia will play a role. Insomnia means sleep issue, right? Will play a role in hardening of the blood vessels. So it's important to address the cause, not just treating the symptom, right? So if the patient is coming with insomnia and then also they have atherosclerosis, so for me as a physician, I should look more for inflammation, which is caused by that insomnia. And that's why that inflammation is causing a lot of like more symptoms happening for patient. So it could be just atherosclerosis, but later on they will come with dementia, they will come with Alzheimer's disease, right? So it's important to find the root cause, and that's why we believe that this is a comprehensive view in medicine, which we take care of the patient as whole. So we are not just doing a symptom therapy. For diagnostic approach in natural medicine, what we have, so for sure we do have a physical examination, we do have the blood work, and also we do have some functional testing. So the functional testing includes like stool, saliva, urine, blood, and then from there we do more assessment of what's going on, what is the root cause. Again, it's not diagnostic, it's more kind of like for prevention. So we can see, okay, this patient, because of deficiency in this enzyme or in this vitamins or this cofactor, they are more prone to get heart disease in future, right? So prevention is better than treatment, always. So the holistic analysis in naturopathic medicine is doing a great job in working every single steps of daily life, including your lifestyle, diet, exercise, sleep, and then also mood, emotions, and then go a little bit more around the surrounding, like environment, toxins, and exposures. So treatment options we have are not limited, but they are kind of like listed here. It depends on the patient need. We may come up with some just dietary and lifestyle changes. Sometimes we need to give them some supplements, herbs, acupuncture, massage, or kind of like more natural-based treatment option. But back to today's topic, which is more cardiovascular. For cardiovascular diseases are, if I want to list them, they are a lot, right? But mainly today we'll talk about the blood pressure and lipids. And I will give you some tips for how to choose the best, for example, oil for cooking that can prevent from cardiovascular disease, like for example, atherosclerosis prevention, or prevention for heart disease of hypertension, right? Like DASH diet, for example. So we will talk about quite a lot about the different types of diet that can be beneficial for heart health. And also I will be talking about some tips for choosing the best oil for daily life. So as I mentioned, prevention is always the best, especially for cardiovascular disease, because in cardiovascular disease, in this picture, I try to show you those atherosclerotic plaque, which is a cholesterol deposition in the surface of the vessels. And this is what makes us in age of like 40, 50, 60, make people to have less space available for blood circulation, right? And this is what we want to prevent, because studies show that it can start as young as age 10, which is, no one is thinking about that atherosclerosis is starting at that age. Even I remember I was reading an article, they were mentioning that it started at age 1, as soon as we start giving them like the solid food. So anyway, this is something that is happening. But what we should do is prevention. So we should prevent in order to kind of like reduce the chance for cardiovascular disease in the future. And also we want to make sure that there is adequate blood flow to all organs, because when you don't get enough circulation, toxins will accumulate, right? So that's why even for detox, we need to make sure that heart and cardiovascular systems are working properly. So I'm pretty sure everyone has heard about the hyperlipidemia, which is high level of cholesterol, bad cholesterol, triglyceride, LDL, total cholesterol in their blood circulation. And it has been attached to many diseases, like what? Like, for example, coronary artery disease, heart attack, atherosclerosis, stroke, non-fatty liver, non-alcoholic fatty liver disease, or peripheral artery disease. So if I want to list, it will be a lot. So hyperlipidemia or too much cholesterol, LDL, and triglyceride has been linked to some cancers, right? Like cancers of prostate, colorectal, breast, ovarians. Where does those cholesterol come from, right? Those cholesterol are coming from either your diet or through your body's production. So main diet that they are having the cholesterol, as you see in this picture, fast food, processed food, high fat, like meat, animal sources are the main source. And then the endogenous production, because we know cholesterol is needed for production of many hormones. That's why we need cholesterol, but we need a good one. Triglyceride, unfortunately, the most common source of triglyceride is from diet. So if you watch what you eat, you should be able to manage the triglyceride. However, still a small amount of that one will be produced internally. So that is something that also it's not under control, but still about 80–90% of triglyceride is coming from food. And this is type of the fat that will be stored in adipose tissue. Adipose tissue are fat tissue, like the fat that we have around heart, the fat that we have around internal organ. Those are triglyceride. That's the one we don't want it. Most of the fat around the belly, that is triglyceride, right? Where they are coming from? Food, like fat, butters, margarine, cooking oils, nuts, seeds. Alcohol, unfortunately, has a lot of like contribution to elevation of triglyceride. Blood pressure is the other concern in heart health, and it's the time that blood pressure go high for different reasons. Sometimes even we don't know what is the exact cause, right? And that one is also attached to many different diseases like kidney disease, eye issue, brain hemorrhage, cardiovascular disease. But again, what should we do? Because sometimes something is on our control, but sometimes it's not. So that's why I mentioned prevention and early detection is the key here, right, for cardiovascular disease. If a patient is having heart attack today, it's not a disease of night. He had that kind of like atherosclerosis for the past 40, 50 years. That's why I said we should be mindful about eating. That's why I said we should be careful about what we choose for oil, right? So, and the prevention. So mainly today we will be talking about how to prevent those, and also if we have high level of cholesterol or high blood pressure, then what should we do in order to manage those conditions. So this slide here is showing us some of the modifiable and non-modifiable risk factors. So modifiable is something that we can do something in order to make them better, right? For example, your diet, your weight, your the area that you're living in, exposure to toxins, but something is not really under control, like genetic predisposition, being male or female for certain conditions, right? Like gender or ethnicity, race, right? These are something that is fixed. And so far we have no kind of like control over that one. But for the modifiable, this is what I want to present today's kind of like talk for cardiovascular. So let's start with exercise, and then we go from there, like sleep, stress management, diet, mindful eating, smoking cessation, alcohol moderation, and weight management. I'm pretty sure everyone has heard about the effect of exercise on heart health, right? But if always, this is when even when I teach students, I would ask them to ask themselves why you think this is good for this condition. So if you are able to answer that why question, it means that, okay, I know why I should do exercise. If you just say exercise is good because it's good for heart, this is not convincing you to do exercise, right? So be a little bit more mindful about what you want to do, right? So exercise should be a regular exercise, and it should be kind of like constant. So the recent studies are showing that at least 30 minutes most of the day, or 150 minutes for 1 week. So that is like a least exercise activity which is recommended to help with cardiovascular health, because it shows that cardiovascular, like the exercise that we do, is improving HDL. And you know, HDL is a good cholesterol. And there are not much supplement-wise we can do to increase HDL. In female, HDL is slightly higher because of hormones. But even after menopause, that is not anymore a good protective factor for them. So the only thing it says that it can improve HDL, one of the most proven one is exercise, which is increasing the good cholesterol. And then the other one is it shows that when we do exercise, the inner layer of the vessels, they function better. So why is important? Because the inner layer, which we call them endothelial are able to release some substances that can cause vasodilation. Vasodilation means making the vessels to be kind of like expanded. So if you have a blood pressure, then exercise would be a good one to kind of like decrease blood pressure even, right? So for those kind of like reasons, effect on the HDL, effect on the LDL, bad cholesterol, effect on inflammation and endothelial, it's good to consider exercise. But again, the prevention, I think there was a abbreviation here, I forgot to mention, SMART. The goal should be always SMART. SMART means specific, measurable, achievable, relevant, and time-bound. Because if you have an elderly at the age of like 80, I should not give the same plan for exercise or diet compared to a young male at the age of like 30, right? So everything should be individualized. Otherwise, we will see a lot of like complications happening. I like this slide. I wish we had something like this, like a speedometer, but for stress, a stressometer. Maybe we don't have it because if we have it all kind of like it's more toward the orange or yellow part, hopefully we will stay on the green zone. So this is another things that is stimulating the hormones and neuroendocrine system to cause some inflammation for body, right? So we know inflammation, like this morning I had a class and I mentioned that inflammation now is the major cause for many diseases. Like when I was in medical school, inflammation was not really a main kind of like a major thing, but now inflammation is considered to be a risk factor for many things: cancer, Alzheimer's disease, cardiovascular, autoimmune conditions, right? And stress is actually playing an important role in inflammation. So that's why if we control stress, inflammation is reduced. Inflammation is reduced, almost everything is reduced, right? Like heart, cardiovascular disease. That's why be mindful about your health, right? I'm not sure how many of you practice to set aside a time just for your self-care. Self-care is not just taking shower or something. No, it's like listening to your body, like feeling your emotions and paying attention to that one. This is called what we call it like self-awareness or mindfulness, right? Mainly mindfulness has been related to eating, which I have on a slide. I will talk about that, but mindfulness is not just for that. Mindful because of your stresses. Try to cope with your stress. Stress is kind of like a part of the daily life for everyone, right? But we should know how to cope with that stress because inflammation is happening and then causing a lot of cardiovascular disease. Sleep, maybe people don't know that sleep is kind of like important for prevention of cardiovascular disease, like having a good sleep. In this picture, I know it's not kind of like it's more in a higher level, but it's showing the brain and the effect on the heart rate, which is the first one, and the sympathetic and parasympathetic, which are the autonomic nervous system. And this is while the person is awake, and this is when a person is in deep sleep. And you look at the heart rate decreased, right? I usually tell heart is one of the organ which is never stop working while we are alive, right? So it's the organ that is working 24 hours, 7 days a week, right? For hopefully for 100 years above. But then we should be thankful. We should be caring about the heart because it's working too hard. We should give them some time to rest. What is that one? Is your sleep? Because when you go to bed, everything kind of like come down. Sympathetic nervous system, which is your fight and flight system, is reduced, and it's time for your heart to kind of like regenerate or refresh, right? And this is what is helping with hypertension. So many people who have hypertension, sleep is an issue. For most of them, sleep has been an issue for quite long term. So that's the importance of sleep. This is mindful eating. So mindful eating, I had seen people a couple of days ago. I was seeing a person who was driving, talking on phone and eating. You see, so I don't know how they are getting the absorption which is needed for that food, right? So being mindful about eating is paying a full attention. This is something that is happening in my house. Like when we are gathering around the table for lunch, I ask everyone, just talk about the food, nothing else. Because first of all, we put things together to prepare a lunch for everyone, right? So this is the first thing that here is telling us when you are mindful, you think about what to choose for your lunch that day, right? If you don't have any thinking around it, you just eat something to feel not anymore hungry. That's it, right? So just to give you some satiety. But then when you are mindful, you have some thoughts from like day before to prepare the material. So these are all mindful eating. So mindful eating is when you are eating an apple, is just eating that apple. It's hard to understand what does it mean, but it takes time to kind of like understand, but it's like when you are biting an apple, it's just an apple. So we have to be mindful about the texture, aroma, any emotions that comes to you, because we all have an emotion because of that food. That's fine. Don't do any judgment, acknowledge those one, and then be fully present at the moment to feel the satisfaction. A lot of people are having obesity and cardiovascular disease. And then when you ask them, are you getting the satisfaction of the food that you are eating? Most of them, they say, no, there is no satisfaction. And you know, the satisfaction is related to an hormone which is called dopamine. So when dopamine is there, you get satisfied. When you get satisfied, you stop eating anymore, right? So it's helping with weight management. So being mindful about eating is crucial for heart health as well. And this is what I mentioned. When you are mindful about your eating, it's helping you to choose the food that has less calorie, or they have less fat, or they are better in oil, for example. There are a couple types of diet that we have in heart health friendly. One is Mediterranean diet, which I believe most of you have heard about that one. So Mediterranean diet is like a pyramid, as you see here. So the most important part is gathering and being together. And they, as you see, there is kind of like wine here, and they were thinking that how that wine is good or protective against Alzheimer's disease. But later on, they found that alcohol is not. Actually, the social life, because of that alcohol, is the one that is protecting from Alzheimer's disease, right? So being social is part of the Mediterranean diet, which I'm grateful for having this kind of like gathering around for in my back home culture. Always people like to have companies and eat together and have like share the moments together. But looking at this one here is showing us like every day, and this is like at least twice each week. This is like weekly, and then less often, like maybe once a month or every other month. So based on that one, then you see how they are emphasizing on fruit and vegetables, and then fish, and then we do have like the poultries and egg, and then the red meats. So, and the other diet has been linked to cardiovascular health is DASH diet. DASH diet is dietary approach to stop hypertension. So it's more emphasizing on antioxidants, vegetable, fruit again, low sodium and high potassium food, low sugar and low saturated fat. So this is kind of like another approach for hypertension. The other thing, it's important for heart health. I'm not sure if everyone has heard about that one, but this is really important, is age. It's advanced glycation end product. And I'm pretty sure nowadays you guys are hearing about air fryers as a good method for cooking, but really they are not. And I will tell you why, because of production of this age. What is this age? This age is a reaction which will be formed between a sugar and protein, lipids, nucleic acid, and something else. So the higher amount of the sugar is, then the age production will be increased. What are the sources of ages? Is that just because of the food that we are eating? No, we do have exogenous age as well. Like when you expose your skin to sunlight, like UV, there is age production. But there are certain types of food that they are high in age, and some of the other one, they are low. But in addition to that one, the method of cooking that you choose also is going to change the amount of the age which is produced. Age is linked to cardiovascular and skin health. Most of, like compared to the other system, these are the two systems that a high age product are linked to, one is skin health, the other one is cardiovascular health. So what they do when we have more ages in the body? First of all, they are increasing oxidative stress. I do functional tests for my patient and see oxidative stress is to the roof. It's like number 9, 10, right? Why is that for? They say, oh no, I am taking vitamin C, I do this, I do that, but it's still oxidative stress on the roof. Ask them for the cooking method. Most of them is either like deep frying or air fryer, because they have heard nutritionists are talking about that. Unfortunately, I was listening to a couple nutritionists who were talking about air fryer as a good method of cooking, which I was surprised. Air fryer is not. I will talk about that soon. Age is related to atherosclerosis, which is the hardening of the blood vessels, endothelial dysfunction. So people might have some damage to blood vessels, like usually they are coming with cold hand, cold feet, right? That is another sign for circulation because of endothelial tissue, and increase the risk of diabetes because it's changing the metabolism of sugar, right? These are kind of like the ways I mentioned. We will get those ages anyway, because when you go out, sunshine, good for vitamin D, but on the other side, ultraviolet is giving you some of ages happening in your skin. That's why it's causing like wrinkles, right? This is exactly the function of age. And some food, they are having higher sources of age, like meat, like cheese, butter, and meat, as I said. Some of the other one, they are having lower ages, right? So we have to choose, first of all, the food or fruit or vegetables that they are low in age, and also the cooking method. The worst type of cooking method is listed here. So what they are: frying. Doesn't matter what type of frying, air frying, deep frying, pan frying is better. I try kind of like to put them in order. Why? Because age is produced when you have high heat and dry exposure. So in air fryer, they are proud that you are not adding any oil, which is okay, fine. But then on the other side, no liquid, nothing, is just a piece of meat, chicken, potato, whatever, go in high heat. So it's dry, high heat, right? This is what is giving us more ages. The other one is roasting and grilling, right? So that's why this one here is they are the best type of cooking methods that we have so far. So the best one is steaming, stewing, like make a stew, beef stew, for example, or poaching, boiling. So look at all of those one, there is water in there, right? So that's why it's not anymore dry, right? So the less dry and the less heat is in there, that is less production of age. When age go higher, first skin, two cardiovascular system will be damaged, and the system kind of like will end up with atherosclerosis, if you are thinking about longevity and living for longer time, this is one of the things that we have to be mindful about, like no age. The other part is like the oils, that we have to be mindful about what we choose to help with cardiovascular health. So for oils, I try to put kind of like couple example here, and telling about like what should we do, like what we should pay attention to when we are buying those oils. Let's go over that one, and then I will tell you what are my suggestions for choosing the best type of the oil. So the first one I put here is the extra virgin oil, olive oil, or EVOO, sometimes it's abbreviated. There are some advantages, almost no disadvantages, but some people may say that it's expensive, or it's like they don't like the taste. Yes, if you consider this one as a disadvantageous, then yes. And smoke point is the other one we should put in, like pay attention to, because if you're using that one for cooking, then we should pay attention to that one. Extra virgin olive oil, some textbook or articles, they said that it has a high smoke point, but it's not really high. So it's not good for deep frying. Anyway, deep frying is not a good method of cooking. Anyway, we talk about that one. So I assume that no one is doing deep frying. That's why I don't recommend olive oil for that. But other than that, smoke and the olive oil can be used for many different types of cooking that you have. So if you want to kind of like saute the onion, or if you want to add a little bit of oil to your rice or to salad, that's perfect. They are high in monosaturated fat. They are high in antioxidant. At the end, then when we are done with the oil, I will give you some tips to pick the best virgin olive oil, not pure olive oil. Next one is avocado. Avocado is also another healthy oil that we have, and you can find the pure organic olive oil in many different stores. They are high in monosaturated. They are having a kind of like a pleasant flavor, and because it's neutral, and then kind of like a expensive, higher smoke point. So this is better option for frying. If you want to do kind of like pan frying, once in a while you may do like eggplants, zucchinis or something, that would be a good option. And the next one is coconut oil, which is in a gray zone, right? So you have heard good things and you have heard bad things about coconut oil. Coconut oil as an oil that we eat, it's kind of like, first of all, because of taste, which is kind of like more sweet in taste, is not in favor for many kind of like recipes that we have. But on the other side, because it has MCT oil, it has a medium chain triglyceride. Articles has shown that this is protective against Alzheimer's disease. So even though it's high in saturated fat, but it's high in medium chain triglycerides. So that's why coconut oil still remains on one of the good top part of the oils if is indicated. My suggestion is olive oil first, avocado, both of them together, and then go with the other oils if you want. Like grape seeds, for example, it's fine. It's high in polyunsaturated fat, and the smoke point is high. But the problem is, the concern that we have is omega-6 to omega-3, right? And in American SAD diet, which is standard American diet, we do get more than what we need of omega-6, right? So that's why I don't recommend this one unless I do the test and see the patient is having an issue with omega-6, then I may recommend grape seeds oil. But other than that, really, I don't recommend because people are getting omega-6 from the other sources. The other one is canola oil is perfect, but the problem is the processing methods, right? So the canola oil that we see in Walmart, Costco, I believe they are not really canola oil, because the processing method, if it's really a real process for production of canola oil, it should be much more expensive. So again, let me not to talk about that one. I'm not here to judge what they do, but the processing method is what is concerning for canola oil. It has a smoke point of like 400 degrees of Fahrenheit, which is kind of like okay for frying, but the problem was processing. Sunflower is high in omega-6 again. So that's why I'm not saying it's bad, but because we are taking too much of omega-6, that's why I don't recommend it for people. And then extra virgin olive oil. So extra virgin olive oil, or EVOO, is coming from the first pressing of the olives. And they are not using any heat or chemicals. So that's why when we are looking at the brand, or when we are looking at a bottle, what you should pay attention to is the name. If they say extra virgin, it is different from if they say it's pure, extra pure, or refined olive oil. So don't buy any of those ones, refined or pure, extra pure. None of those one. Why? Because they are using heat or some chemical processing in order to make olive oil pure or refined. So what we are looking for is just the first pressing of the olive, which makes the oil come out of that one. Maybe you have heard about cold compress. So I will talk about that one later on. So cold compress is kind of like different from extra virgin, but they are good as well. The other characteristic of olive oils are having an antioxidant. So antioxidants are a main component of olive oils, and that's why we recommend people to take it. But processes like with heat or chemicals are taking away that kind of antioxidants and polyphenols or oleic acids that we have. But I'm fortunate enough to see a lot of patients in my practice that when I do their functional testing, all of them, their oleic acid, which is omega-9 related to olive oil, is high enough. So far, I had never seen any patient that they are kind of like have a low level of omega-9, which is indicating of not taking olive oil. Low acidity is the other one. Some companies are making the acidity for olive oils to become like low acidic, but with some chemical process. So that's why when you want to buy olive oil, make sure to read the label first of all, look at the name for extra virgin, not for pure or refined, and then check for the harvest date. Sometimes it's written there, the fresher, the better. Olive oil is not the alcohol. So olive oil aging is not good for alcohol, for olive oil, right? So as soon as you buy, you have to consume it in maybe 4 to 6 months. And if you are following the Mediterranean diet, that should happen, because in Mediterranean diet, it's recommended taking at least 2 tablespoons of olive oil daily, right? So that would be equal to 30 cc or milliliter of olive oil. The next one is looking at the quality certification. Some of those one, they have this one, making sure the origin or the country that they have been harvested. The best, it's hard to find, but the best one is the one that has only one country as a source for the olives. Most of the olive oils that we have in the market, they say like Italy, Greece, this, that, this, right? So they give you a list of countries. And we don't know about the process in every single country, right? So just try to go with one that you already know, you did your search, and you believe that they are doing best because they are approved under one of those quality certification as well. Make sure the bottle is light, is dark, because olive oil is very sensitive to the light. And I mentioned avoid the pure refined olive oil because they are going under processing. And then storage, I mentioned that you have to be able to consume that one in 6 months or even less. This one here is just giving us a little more understanding about the difference between cold press and extra virgin. The cold press extra virgin they both are good. But the cold press is more talking about the extraction process, compared to the extra virgin is more talking about the quality and the grade of the olive oil. So the better extraction process we have, the better quality we will have, right? So cold press actually is a good method for gaining the olive oil. That's why we say cold press extra virgin olive oil would be the best for choosing your olive oils. But it's important to note that not all cold press oils are necessarily extra virgin as well. So if you can find cold press extra virgin, that is the best. But if you can find cold press and then they say something else like pure refined, that's not the best. So go with extra virgin first and then check the cold press or not. So for management of diseases beside whatever we discussed for diet, then there are a list of like supplements. I will be done soon, so then we will have some time for discussion if you have any question. Like, as I said, for HDL, exercise shown that it will do something to improve the HDL, antioxidants, fatty acids, omega-3. For decreasing of LDL, olive oil shows some significant reductions if it's on every day, not as a treatment. No, it's just kind of like as a diet for every day. Vegetables, fatty acids, again, like omega-3. Triglyceride is a little bit harder with supplement. It's better to control with the diet. And triglyceride, unfortunately, has been linked to many pancreas disease. So we have to be mindful for decreasing triglyceride through diet, like no processed food, no alcohol or limit alcohol and sugar intake, because too much carbohydrate also will switch to triglyceride as well. In the market, you will see there are a lot of like supplements like red yeast rice or plant sterol that we do have, yes, but is that safe for everyone? No, it's we need to see like what are the levels of the cholesterol, what are the kind of like the symptoms or underlying condition. But the article shows that red yeast rice is doing very similar to statins, which we give as a medication for people with cholesterol. So symptoms are, I mean, the complication are very similar to statins. But it's more natural. That's the difference. So it's kind of like coming from fermented rice. So this is one of the natural supplements. We have plant sterols. They are natural compounds that we have in plants that they show that they are helping for lowering LDL. And liver detox. I do a lot of like liver detox on springtime or fall, just to get rid of the toxins, right? So liver detox, if you guys are interested in liver detox, we will have a Zoom talk on March 13. And whoever participating here, then we will do a group, a kind of like a detox program for 3 weeks together. But it needs an individualized plan. So if you're interested, then let us know. We will send you more information as we go. But the date is March 13 at 2 p.m. for detox. So we should stay together for 3 weeks in order to do this detox to help with cardiovascular and also liver pathologies. Some of the other supportive supplements that we have for heart health are adrenal support, but not for everyone. So people that they are having some adrenal health issue, like chronic adrenal fatigue, for example, or adrenal insufficiency, they may benefit from this one. Antioxidants, yes. Vitamins, because many vitamins are playing a role as a cofactor, so we have to give as needed. Amino acids, yes, like methionine, maybe you have heard, but again, not for everyone. We should see and do the test and see who is deficient on that one, then we can provide it. Anti-inflammatory diet, we already talked about that one, yes, is needed. Adapting a heart healthy diet, we talk about the DASH diet, we talk about Mediterranean diet, so making sure people are emphasizing more on fruit and vegetable or whole grain, less sugar, less sodium, more potassium, more fiber, and seeds. For hypertension, also the DASH diet was the best, potassium, magnesium, antioxidants, fiber. We do have a couple like supplements that they really are doing great job in management of hypertension. But again, is that recommended for everyone? No, not really, because we need to know how severe is the hypertension, what are the other risk factors, is that primary hypertension, secondary hypertension. So many factors are playing a role in our decision. And then finally, for conclusion in cardiovascular health, for the cardiovascular health, I should say it's a versatile approach is needed here. So it's not a disease that is happening, even though the symptom is happening in a second, like cardiac attack or MI is happening in a second, but the pathophysiology has happened for the past 40, 50 years, right? So that's why we have to pay attention even in children, right? Who are having like sweet tooth or they are having like obesity. We should just remind them about the effect of the weight on cardiovascular, stress management, weight management, physical activity, and be mindful about what they eat, be mindful about what they choose for their lunch and their life. So I will be ready to answer if there is any question here. Yes.
Doctor, I'm so grateful for the lecture. It's very fundamental and practical. So I'm asking if I can review the video. Will you provide a link for
Sure.
the recording? Thank you.
Angela, do you want to?
Yeah, we won't have a link until after it's recorded, but I'll go ahead and put my email address in the chat. And if you'd like the recording, you can go ahead and shoot me an email.
Thank you. Yes, Lee.
Yes, can you make any comments about homocysteine related to B vitamins? I've heard that as women, if our homocysteine gets up too high, that's not good.
Yes, good. That's a good question. Yes, this is actually one of the, it's not just for female, it's for everyone. So when I have a patient with kind of like for first session, and I want to check if they have had any cardiovascular risk factor, homocysteine is one of the tests that I check. And homocysteine will go high if B12 is low. And the high level of homocysteine is linked to cardiovascular diseases. So that's why we want to check the homocysteine and see if the people are having higher level of homocysteine. Then we have to check the B12. And then if B12 is okay, there might be some other cofactor deficiencies that might need to be addressed. So yes, it is related to cardiovascular health.
Should I reduce my B12? I'm on methylated Bs because I've got
Methylated Bs are perfect. Have you had a high level of homocysteine?
It seems to be going up. I'm working with a genetic person who's kept my records, and it's 9. I think 9.8 is what it is right now.
Okay, 9.8 is not that high. So we prefer to keep it around like 7. But like for your case, because if it has been higher before and now is like 9 point something, that should be fine. So I don't know your health, but I think what you are doing is helping. So
okay, thank you very much.
You're welcome. Yes. I see someone raised their hand.
Thank you very much, Dr. Sarebanha. That was a wonderful talk. I have a question. If you could explain the difference between systolic and diastolic pressures on the blood pressure reading, and what a high reading of either one would suggest to you.
So blood pressure in general, I think I had the slide for the definition for both of them. But blood pressure is the force of blood against the blood vessels, right? So yes, this is the definition. So the force of the blood against the artery wall, if it remains high all the time, this is considered to be blood pressure diagnosis. We have 2 numbers for reading of the blood pressure. The top one is systolic, the lower one is the diastolic. Systolic refers to the time that we have contraction of the heart, and diastolic is referred to the time that we have relaxation. So by relaxation, I mean we need to kind of like grab more blood coming to the heart, right? So if it remains high, it means the heart is not going to relaxation, to enough dilation to get back the blood into the heart. So either way, there is a criteria for diagnosis of hypertension. So most people, they have, when we say they have the hypertension, it means that the systolic blood pressure is high. But also diastolic blood pressure go high, but not as quick as systolic. So for example, if normal blood pressure is 120/80, then we say if blood pressure is more than 139/89, that could consider, but you see how differences is between 120 to 139 compared to 80 to 89. So this is what I mentioned for diastolic. We don't have a rapid elevation most of the time. That's why even a slight elevation in diastolic would be a sign for hypertension. So we do have people that they only have diastolic hypertension, or they have only systolic hypertension. That is mainly related to like heart structure, like anatomy issue most of the time, or it might be related to some underlying diseases that they have. But the rest of the people, they have hypertension as elevated, both systolic and diastolic. Okay, I think that's it.
All right, well, yeah, this is wonderful. Looks like if folks don't have any more questions, we can go ahead and wrap up. I hope everyone sees my email in the chat there. Feel free to reach out to me, of course, if you have any questions or would like to schedule an appointment. And keep looking at those newsletters because we've got a lot of good talks coming up as well.
Thank you, Angela. Okay, I think we can end the recording.
Yeah,
Thank you.
thank you, everybody.